And so our next speaker is Dr. Prashanthi Atluri. She is double boarded in internal medicine and cardiology, and she is one of the kindest souls I know. She is going to talk to us about her practice. Her practice is showcased in one of the tables in the back, so make sure to check that out. North Lake is the name of her practice. So she's going to talk to us about her patient testimonials, about the unique approach that she has in treatment and care. Thank you, Dr. Prashanthi.
Thank you, Evelyn, and thank you, everyone. How is everyone doing today? So far, good? All right. So I just wanted to thank everybody. This is my second year coming here. So, I had a great time last time, and I was able to communicate and then connect with everyone. So today, this is my second year. So I'm Prashanthi Atluri. I'm a general cardiologist, and then I'm an intern. Before that, I'm a mother of 2 daughters. I'm a wife, and I'm a daughter to my parents. So years ago, when I started off, I was just a regular doctor who was trying to find a great drug, a great research or something or the other in order to help out my patients. So, and then, I was just a fresh graduate in 2012, and then I was just working, doing other things. I was in a very big center at the time. So in 2014, my daughter, who was 7 at the time, she was facing significant health issues. She had gut issues, she was having attention problems. Then the school called me up saying, hey, listen, your daughter has X, Y, and Z diagnosis, I think. So you need to go, take some help. And then we're going to put her on, maybe they're going to, and then when I went and sought the help, they said she has to be put on an ABCD drug. I'm like, okay, what is going on here? She's very sick and you're telling me that she has some significant diagnosis, and then you want me to put her on some medication. Then I opened the medication package list, and then I was like, oh my God, I looked at all the side effects of the medication. I'm like, no. Nobody is touching my daughter with this many side effects because everything is listed under there as a cardiac side effect. I'm a cardiologist, and you want me to place my daughter on a cardiac drug, some sort of a medication with cardiac complications, and you want me to observe her. This experiment is not going to happen right in front of my eyes. So then slowly, then I started researching, when we are hit by a health crisis, I think we become a wonderful researcher. And we are not going to stop for anything else, or we are not going to settle for any kind of halfway answers. So that's when my journey started. I started questioning what was going on. I needed to fix it at the root of her issues, the root cause of everything, right? So I'm like, why? So that why kept on going on. So I kept stumbling into the diet part, and then I came across the lifestyle. Then my whole world, it kind of changed totally. My whole perspective of, the way I was trained, zero value was given to nutrition. Zero value was given to lifestyle. All of it is okay, patient has these symptoms, patient has this lab, then you're going to match the patient with these pharmaceuticals, and then the test, and then you're just going to go on with your life. But then, when it came to my own condition, my own daughter's situation, I said, no, this is an experiment, science experiment, I'm not doing it. That's when I started thinking like a patient. So then years went by, my daughter started doing better. I started preaching it more and more in my practice too, at the big center. Then I was called as a critical thinker in my department. Oh, look at her, she knows it all. So everybody was like, okay, critical thinker, right? And then the 2020 mandate came. Again, the critical thinker in me was questioning everything, but they didn't like it at the time. So I was let go. That was in 2021 from a big center. So I was like, okay, what do I do from here? What am I going to do? And totally lost because I don't want to drug anybody. I don't want to not put anybody on multiple things. and not, but then who is going to come to me? I'm like, who is there around here who wants to, ask the same questions, who wants to fix it at the root of their issue, who wants to work on their diet and lifestyle, who is going to do it, and who is going to say, I don't want any of these side effects from these pills, I don't want the suppression, so I don't want to suppress my symptoms, but I want to work on it. So then my husband was like, you will find somebody, even if you don't find someone, don't worry about it. Then what happened was I was connecting to a lot of grassroots movements back home in India. I'm from India. So and then my friends were like, what are you talking about? Here there are so many patients who have been drugged, who have been on ultra-processed food, and their health is falling apart. You should open a telemedicine clinic. So then we opened up a telemedicine clinic. It's a worldwide organization where we only address patient health conditions. We don't even call them patients, we call them health seekers. Because if we call anybody a patient, that means they are going to be part of the sick care. We don't want anybody to be part of the sick care, we want them to be part of health building up industry. So then we started putting them on diet, lifestyle changes, one by one. The amount of healing that we saw in the community was amazing. That gave me more hope. People were looking for the right kind of mentor who on a health guide who would help them out. So slowly again I gathered the courage and we opened up a practice in Mandeville. It's called North Lake Cardiology and Welfare. So, and then again the same questions, right? How do we tell everybody that it's not right to suppress their symptoms? It is always the best thing to do with their symptoms. Start with their symptoms. Symptoms are nothing but sacred messages from your body, telling that the body, there is something wrong inside the body. You're not supposed to be masking it, you're not supposed to be gagging it, but you are supposed to be tuning into your body in order to connect to your symptoms, in order to see what is going on inside the body. So slowly, steadily, more and more referrals started coming in, more and more health seekers started knocking on our doors. Some of you, I'm sure there is a health seeker that I have already met before in my clinic. I don't want to point out any hands or anything, but yeah, slowly but surely people are asking questions and they are knocking on our doors. So it's been 2 years since we started the practice, but the amount of healing, the amount of weight loss without the side effects of Ozempic or any of those drugs, it's like I think we almost made patients lose up to 1,000 pounds of weight. 1,000 pounds of weight just came all of a sudden, just by adjusting their diet and lifestyle. The number of medications that we were able to pull them off of, and then the amount of hope we are filling up in the community is tremendous. And then again, as Evelyn was saying this morning, right? It's the health seekers. You guys teach us a lot. When you ask questions, when you ask the right questions, when you say you shouldn't be settling down for anything less. If the physician is not telling you what needs to be done, and they're just going in and out of the room within 20 minutes, just telling you some tests and then putting you on a medication, maybe that's not the right physician that you have to be seeking. But there are many people, it's your demand that's going to change this sick care industry. Yeah, we need some amount of sick care, and we need some amount of accident and emergency care. But we don't need this kind of a sick care where we have a drug for every symptom, but the patients are not getting better. Day by day, the amount of injury, pharmaceutical injury, or any kind of, a symptom suppression is leading us is tremendous. So, yeah, so this is what, I just wanted to let you know that you guys will be the main people, main folks who are going to be changing the world out there, because only because of your demand, things are going to change. So I'm going to I have few quotes from my patients. So one of my patients was who came in for diabetes and high blood pressure, and we were able to change his diet, lifestyle. He was off of his medications. So one day he came back and said, Doctor, I'm going to take a road trip for 2 weeks. And I was like, oh, all of his diet and everything has gone down the drain. What am I going to do? Then he looks at me and tells me like I asked him, what are you going to eat? How are you planning your journey and the vacation? He looks at me and he said, Doctor, you are the one who told me right next to any kind of McDonald's, there is a grocery store, and always walk into the produce section and get what you need. So that's what I'm going to do. You told me what to do and I'm going to do it because you gave me a prescription. So I'm going to stick to the prescription. So this is like many stories of like medication relief, many stories. Any kind of autoimmune condition, we don't even call it autoimmune condition, we call it like an autoresponsive condition. Psoriasis, rheumatoid arthritis, you name it, we have been able to fix them at the root of the issue. See, again, we don't even just work with them on their diet and lifestyle, but we even look at their emotional health, we talk to them in detail, we work with them. I'm very thankful to my medical assistant, Barbie, she's over here too. So she's the one who kind of like calls them back for accountability and for motivation. And it's amazing how things are changing around us. And it's going to keep changing, but we should never be settling for anything less. So yeah, if you have any questions or anything, you feel free to ask us. But you can explore us at North Lake Cardiology and Wellcare. We have a nice website. And then if you want, we can list you up for our newsletters and other things. But yeah, we have a lot to share with you. I just have two important books. I'm a big book reader. I love to read old books. Okay? So I just want to share this book with you. It's Toxemia Explained by Dr. Tinder. He's from the early 1900s. This is a wonderful book. If every physician reads this book and practices it on himself or herself as well as on their patients, we will not be seeing any kind of health crisis, the one or sick crisis that we are seeing these days. And then the other book is all about, all these are like, these are the kind of books they should be encouraging us to read, which is going to put health back in our hands and is going to ask us to take auto responsibility of our health rather than outsourcing our health to somebody else who has no clue. So these are some of the books, but read more. There is a lot of good information out there, but pretty much all of it has been suppressed or misinformed or it has been diluted. So yeah, again, thank you so much for everybody. Your presence means a lot. Yeah. Your presence means a lot to us, and again, take health back into your hands again, and you demand for more. Thank you.
Thank you, Dr. Prashanthi. I appreciate you.